Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is February 12th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 108 million cases and nearly 2.4 million deaths. In the United States, we have over 28 million cases and nearly 490,000 deaths. The number of cases in the United States does continue to fall, and now hospitalizations and deaths are also falling. Scientists expect the downward trend to continue, but we'll likely see a bit of a bump because of the Super Bowl. Gatherings and stuff like that from the Super Bowl, probably 1 to 2 weeks from now, we'll start seeing a little bit of a bump in the numbers, especially cases. After that, maybe some hospitalizations and deaths, a few weeks after that, but hopefully not too many. It really depends on how many people actually took precautions and kept their gatherings small or didn't gather at all. So we'll see. Scientists believe that most of the decrease we're seeing right now is due to increased compliance with the CDC guidelines, and also the fact that we just have less gathering now that the major holidays are done. It's estimated that around 40% of the U.S. population has either had COVID-19 already or has gotten the vaccine. So it's possible that we might be seeing a little bit of the early stages of the herd immunity starting. It's definitely not enough yet to be true herd immunity, but it may be enough to slow the spread down a little bit. So hopefully that's taking place right now, and hopefully as we get more people vaccinated, it'll slow down even more. For now, we just need to stay vigilant and keep following those guidelines. This week in vaccine news, Pfizer has said that they expect to be able to cut the production time nearly in half for their vaccine. Now that they're starting to ramp up production, they're starting to find more efficient ways of doing things, and so they expect that to be a lot faster. So that's really good news for the entire world, since we're basically in a race right now to get as many people vaccinated as possible before the variants mutate to the point that they're able to beat the vaccines. Like I explained in previous reports, the more people that get vaccinated, the fewer hosts will be available for those mutations to occur, and so the lower chance that there will be of a really bad variant happening. For now, all vaccines work quite well against any of the variants. They don't work quite as well against some of the variants as far as keeping you from getting COVID-19, but they all work just fine at keeping you from getting severe symptoms or death from COVID-19. So AstraZeneca had disappointing results in South Africa against the 501v2 variant. That variant is also being called the B1351 variant. They name them based on different things. It's based on the different mutations that they're seeing, etc. So there can be multiple names for these variants. But anyways, they had poor results from in South Africa against that variant, and so now South Africa has stopped using the AstraZeneca vaccine, and AstraZeneca has decided to work on a modulated vaccine, something that's been modified a bit just to make sure that they can get one that really does work against that variant. According to the latest polls, more people than ever are now saying that they are going to be getting the vaccine as soon as it becomes available. So that's really good news. We need people to buy into the vaccine because, like I said, we need there to be fewer hosts for the virus. We need us to reach that herd immunity. So this is helping everyone to have people get their vaccines. So we're trying to get it pushed out as quickly as possible. There's definitely some issues with that, but it looks to be turning around. We look to be doing better now. So hopefully that'll continue on. In more good news about vaccines, a new study from Israel suggests that those who get the Pfizer COVID-19 vaccine are much less likely to transmit the virus to others. Before this point, we didn't really have any evidence of it just because people weren't able, or the companies were not able to test this. And I mean, this is what scientists expected all along, that it would not only keep you from getting sick, but keep you from transmitting it. But now we have a better idea that is the case. Again, this is just one study, so we'll need more studies to be absolutely certain, but it does look to be the case so far. We still don't know how long immunity lasts with the vaccine, but most of the newer studies are showing that it looks to be lasting longer than we previously thought. So we're still lacking sorely in data. We definitely need to do more research on it. And so we just don't know for absolute certain just yet. Because of that, the CEO of Johnson & Johnson this past week said that we may need to get a vaccine for COVID-19 every year. Get a shot every year, or maybe a booster of some sort every year for the next few years. Again, that's speculation. We don't know for sure. We're hoping that's not the case, but it really depends on how long immunity lasts. So maybe, maybe not. The CDC, however, is very optimistic. They said this week that those who are fully vaccinated, meaning either 2 full shots from Pfizer and Moderna, or when Johnson & Johnson vaccine comes out, that's a 1-shot thing. So basically, you have to have the full number of shots based on whatever vaccine you're using, and an extra couple of weeks just to give your body time to get used to that and build up its immunity. So those who are fully vaccinated like that do not have to actually follow the quarantine protocols if they're exposed to the virus. We still need to follow the other guidelines like wearing a mask, social distancing, avoiding large crowds, washing hands, things like that. But you just don't have to quarantine yourself if you come into contact with someone that is positive for COVID-19 if you're fully vaccinated. The CDC has also released more information on ways to make masks more effective. We talked a little bit about this in previous reports. And so I'll just go over a few things here that they mentioned. One is the double masking, wearing a surgical mask and a cloth mask at the same time. Also, knotting the ear loop of a surgical mask close to the mask, and then tucking in the edges so that it fits a little bit better and doesn't have the big holes. That's another option. Also, another option would be to wear a surgical mask, and then on top of that, put either a tighter neck gaiter, or even just a stocking, a nylon stocking, like a pantyhose type thing. Just cut that, put it over the top of it so that it's around your neck and everything. The main point the CDC is trying to make with these guidelines is that surgical masks work if you have a good fit with them. Unfortunately, most surgical masks do not fit very well, and so that's why we have the extra steps to take. If you can take these extra steps and get that surgical mask fitting really well, it works great. Without a good fit, surgical masks, based on new studies from the CDC, only block about 40% of the aerosol particles. Cloth masks, whether you have a good fit or not, are about the same. If you combine them so that you end up getting a good fit and the filtration of the surgical mask, they've seen that it's over 90% effective at blocking particles either going in or out of the mask. So really, really huge deal here. We need to make sure we're doing that. One thing to consider, though, is because of the extra layers, if you're double masking, certain people may have a bit harder time breathing. Most people will not. Typically, cloth masks and surgical masks are still thin enough that most people will be fine, but some people may have a harder time breathing. And if you happen to be one of those people, it may be better to wear an N95, or since those are in short supply, a KN95 or a KF94 mask, or one of those more advanced cloth masks with the filters, the lab certified filters that they have now. In other news, studies done in subways throughout major cities of the United States showed extremely high levels of pollution. All the tested subway stations showed levels of pollution higher than any safe limits. And some even had levels that were over 75 times the size of safe limits. That's bad. That's like standing right next to a wildfire or a building demolition. Tons and tons of particles are going into your lungs. It's not safe. So unless they're able to eliminate that pollution in the subways and get those cleaned up, which would take quite a bit of work, So unless that happens, I would definitely recommend continuing to wear masks when you go to the subway. Now, a cloth mask, unless it's one of the newer ones with the actual built-in lab-tested filters and all that, unless it's one of those, cloth masks typically won't work very well against this kind of pollution. They may help a little bit, but it'll be minimal. Surgical masks, on the other hand, as long as they're well fitted, so again, maybe the double masking, they actually work fairly well. And of course, the N95 or KN95, KF94, those kind of masks do work really well on that kind of pollution. So again, like I've mentioned before, just because the pandemic is over doesn't mean we should just completely eliminate all masks. Masks are a good thing from time to time. Of course, we don't want to wear them all the time, but for certain things, they really help. A new study suggests that coffee may be good at reducing your risk of heart failure. The researchers found that it must be black coffee because adding sugar, cream, or anything else basically negates any health benefits. They also found that decaffeinated coffee actually increases your risk of heart disease and other things. So this study goes against previous studies that we've seen. Most studies on coffee have shown that caffeine, and not just coffee, but any sources of caffeine, actually hurts the heart. So because this is just a single study and most of the evidence out there, most of the scientific evidence we're seeing from different studies says that coffee is not good for your heart or much of anything, actually. At this point, the general recommendation is still to avoid drinking coffee. Of course, most of the world lives on coffee, at least the United States and quite a few other countries, and people have a hard time getting rid of it. Even doctors, even though they know that coffee isn't good for them, doctors will still very often, continue to drink it. So basically, doctors just say, we recommend limiting your caffeine intake instead of saying to avoid it completely. And the same thing happens with alcohol. Please limit your alcohol intake instead of avoiding it completely. In reality, pretty much just about all the scientific evidence out there, there are very few outliers. And this latest study is one of those outliers. But the vast majority of scientific studies out there tell us that we absolutely do not need coffee or alcohol. They're both bad for us, generally speaking. If we don't have those things, we'll most likely live healthier and longer lives. What gets the most attention from the media, however, is these outliers, because it basically says, these kind of studies tell us, oh, it's okay to indulge in your vices. And of course, everybody likes to hear that. You like to hear that what you're doing is okay. It makes you feel like you're okay. Unfortunately, that's just not the case most of the time. So that's that's the way science works. We have certain studies that are outliers for whatever reason. We're not sure. Sometimes those are significant. Most of the time they're not, because most of the time it's the big body of evidence that really tells us the truth. In this case, we need to follow the general recommendations for now. So please avoid coffee, avoid alcohol. Speaking of those vices I was talking about earlier, alcohol sales increased over 50% in 2020, and many hospitals are reporting up to 50% increases in the number of alcohol-related liver damage cases that they're seeing. It's not a coincidence. So just remember, alcohol is never the answer. Trouble might go away for a few hours if you drink, but when you get sober again, it's still going to be there. And chances are it's going to be a lot worse. So please, just avoid it. All right, to end our report, let's talk about a drug called Semaglutide. It's been used for type 2 diabetes for a while now. A new study, though, gave patients or subjects much higher doses than normal of the drug to test if it worked for weight loss. What they found is that those who received the drug and also received advice on fitness and diet, over 15 months, on average, they lost 33 pounds. Those who received the fitness advice but were given a placebo instead of the medication, over those same 15 months, they lost an average of only 5.5 pounds. Also, of those that received the actual medication, about 20% of them, about a third of them lost approximately 20% of their body weight. So that's very significant. Of course, as with anything, we need more research, and it's not without side effects. The side effects were minor. They included some nausea, some constipation, diarrhea, so nothing major. But we do need to keep studying it to see if it really is safe and if it really holds up in other studies. If it does hold up in other studies, this will definitely, by far, be the most effective weight loss drug anyone's found. It works by suppressing appetite, and so that this could be a really big thing. Scientists, of course, are quick to point out, as am I, that the best way to lose weight is to just start a lifestyle that's just healthier. Unfortunately, that's hard for a lot of people, depending on circumstances, other things. And so these drugs can help. Losing weight, even if you're not able to go to a better lifestyle, just the simple fact that you lost weight can actually decrease the chances of you having heart failure, diabetes, and a number of other obesity-related issues. So definitely try and do better as far as your lifestyle. I'm trying that myself, but this drug is at least an option for those who are unable to do so or are having a hard time doing so. So thank you for watching the Plain English Public Health Weekly Report for February 12th, 2021. As always, we haven't been able to get to everything, and so there are links below the video for you to go ahead and check out the other stories and also to get more information on the things we did talk about. I'm Richard Greenland, and you have a healthy Valentine's weekend.